Experts speak on professional burnout, a presentation by experts. Monica Chandler, Psych 496. Brief overview. Professional burnout. Professional burnout is a condition that can leave a person feeling anxious, depressed, and overwhelmed. The person may experience a lack of motivation, and the symptoms may increase in intensity while at their place of employment. The topic is professional burnout. Professional burnout can cause severe implications, especially for those working in the field of psychology. Clients may receive inferior treatment, and the professional may leave the industry due to the severity of symptoms. Many therapists, counselors, and psychologists feel guilty when they are suffering from professional burnout. They may fail to seek treatment, and therefore it is important for employers and associations to use research to prevent and recognize the symptoms. Brief overview. Professional burnout. Can professional burnout be prevented? What factors correlate to lower the rates of professional burnout and reduce the likelihood of professionals leaving the industry? Introducing our experts. Dr. Shalini Shrivastava has a PhD in psychology and an MBP. She is currently employed as an associate professor. Dr. Shrivastava has been an associate professor since 2010 and has done several studies on professional burnout. She specializes in academia and human resources. Kiki Chang has an MA in music therapy and honors BA in music and psychology. She is currently employed as a music therapist. Kiki Chang has worked in long-term health, mental health, and school settings. She is currently employed as a music therapist at Baycrest Sciences. Dr. Shrivastava ascertains that there are many studies that correlate job satisfaction and professional burnout. She studied and assessed current literature to develop the hypothesis contained in her study. She used previously researched correlations such as depersonalization, emotional exhaustion, and personal accomplishment that either have been shown to positively or negatively correlate to job satisfaction. Her study contains many examples of previous research to support the negative effects of professional burnout and the relationship of job satisfaction improvement with mentoring. Dr. Shrivastava is a member of the International Journal of Management and Social Sciences. The website is a source of journal articles and research that may aid employers and practitioners in treating and preventing professional burnout. Methodological issues unique to this research. Obtaining a participant sample representative of the population being studied. Only one profession was studied. Only men were included in this study. This expert correlates job satisfaction with reduced burnout symptoms. She also shows that mentoring can increase job satisfaction. Her main point is that interaction with and guidance from a mentor can reduce the symptoms associated with burnout, including emotional exhaustion, depersonalization, and increased feelings of personal satisfaction. Nayoung, Kayong, Jung, Ju, and Sang Min's 2010 study supports the findings of Dr. Shrivastava. Music therapist Kiki Chang acknowledges that the literature does correlate professional burnout to emotional exhaustion, depersonalization, and personal accomplishments. However, she also has reviewed literature related to compassion fatigue. According to the literature, professional burnout and compassion fatigue are similar in symptoms, but the cause of the symptoms for a therapist as opposed to a manager may be different. Therapists may experience the same effects as professional burnout because they are subjected to their clients' traumatic experiences. Chang is a member of the Canadian Association for Music Therapy. The association's mission is to advance the industry through research, education, and awareness. Methodological issues unique to this research. Small sample size. The research excluded music therapists no longer practicing. Participants had all recovered from professional burnout. Geographic area of study should be larger. This expert provides that self-awareness and self-care is key in recovering from professional burnout. Professional burnout may be compassion fatigue for those in psychology and medical fields. Education is key in prevention of professional burnout. Bhutani, Balara, and Kalara 2012 study supports Chang's findings. Mentoring, job satisfaction, and talent management are Dr. Shrivastava's main points. Self-care, self-reflection, and coping skills are Kiki Chang's main points. They both agree that personal accomplishment, research, and education are key in treating and preventing this disorder. References. References continued.